which I didn't see anything. His neck is all flat. Can you please lift out your chin for me? Okay, I'm checking right now the thyroid, and I didn't see any enlargement of the thyroid. I'm gonna palpate right now the trachea. It's in the middle position, which is normal finding as well. I'm gonna go ahead and check his thyroid for any nodularity or any enlargement. Can you please swallow for me? Okay, very good. Can you turn your head towards me? Swallow. Okay, very good. On the other side. Swallow. Okay, very good. I just checked right now his tonsil. I'm sorry. I just checked right now his thyroid for any nodularity, which is nothing. So Mikey's neck, there's no there's absence of tubular vein distension, and also his trachea is in midline, and there's no enlargement of thyroid. So what I would like to do right now is to check the carotid for any bruit. I'm gonna use the bell of my stethoscope to check both of his carotid. I didn't hear any bruit on both of his carotid, and also on the thyroid, which is a normal findings. Right now, I would like to palpate the carotid arteries. While checking this, it is very important that you do it on separate time to avoid occluding the circulation. Okay. Just normal findings also. Right now, I would like to go ahead and check your back. Mikey, do you mind taking off your shirt?
No.
I'm gonna go behind Mikey so I could check that. Mikey, do you mind turning on your side?
No problem.
Okay.
Is that fine or
A little bit more.
like that?
Okay. So right now I'm checking on Mike's back. Okay. Let's go this way. So right now I'm checking on Mike's back for any signs of any irritation or any redness on his skin, which is I didn't see. And also I can see right now that the thoracic cavity is in midline position. I didn't see any kyphosis or any lordosis, which is a normal finding too. Right now, I didn't see also while he's breathing, I didn't see any signs of respiratory distress. There's no use of accessory muscle while he's breathing. And the skin also is evenly distributed, the color, and it's appropriate for his ethnicity, which is normal. What I would like to do right now while I'm here on his back is I would like to check the expansion of his lungs. But prior to that, I'm going to go ahead and palpate first the tactile primitus. Using the palmar portion of my hand, I'm going to ask Mikey to repeat the words 99 and feel the vibration. Can you repeat the words 99?
99. 99. 99. 99.
The vibration is equal, and I didn't feel any abnormal on each side. So I'm going to repeat it again. Can you please say 99?
99. 99. 99. 99.
Okay, equal vibrations. What am I going to do right now is I'm going to go ahead and check the expansion of his lungs using the thumb of my finger. I will put my finger in the 10th rib and ask him to take a deep breath, and then watch the divergence of my finger as he take a deep breath. Can you please take a deep breath? Okay. Exhale. There you go. One more. Exhale. Okay, very good. While watching, I did see that there's an equal symmetrical expansion of his lungs as he take a deep breath. While I'm here, I'm going to go ahead also and palpate the costovertebral angle. The costovertebral angle is just right behind the, just right below the intercostal space 10th and 11th, which is right here. What you want to elicit here is the tenderness that usually present if the patient have any ongoing problem with the kidney. So which is okay. Did you feel any pain?
No.
Okay. What am I gonna do right now? I'm gonna put my left palm over the costovertebral angle, and I'm gonna try to percuss it. Feel any pain?
No.
Okay. Do you feel any pain?
No.
I just percuss right now the costovertebral angle. So what I would like to do right now is to is to check the, I'm gonna percuss his back to check for the resonance or hyperresonance while I do percuss. Using my middle finger, I would tap this on the DP joint to check for the resonance. It's very important that you do it on bilateral or systematically portion. Okay. Perfect, they're all resonant. Okay. Usually that is all resonant that you could hear when you percuss already a dullness area. It means that you are already hitting an organ or a solid organ of a patient. So right now, while I'm here, I would like also to check the diaphragmatic expansion of his lung. I'm just gonna go ahead and repeat again the procedure that I just did. And noteworthy, the area from, the sounds changed from area of resonance to dullness. Mikey, now I would like you to take a deep breath for me. Take a deep breath. Okay, exhale it. Take a deep breath. And hold it, okay? I'm gonna go ahead and check for the resonance. I would like to mark it so I would know how far his lungs can travel after taking a deep breath. Okay, now you could breathe again normally. Okay, take a deep breath. Okay, breathe normally. Okay, breathe normally again. And take a deep breath and hold it. Okay. Okay, it is good 3 to 5 centimeter, which is normal. If it is an athlete patient, it could go as far as 7 centimeter. And the findings could still be normal. After percussing his back, I would like now to hear I'm gonna go ahead and auscultate his lungs for any presence of bronchi or any rales or any abnormal sounds. Okay, using symmetrical portion. Mikey, can you please cross your arms for me? And then bend a little bit forward. Cross your arms. There you go, and bend a little bit forward. There you go. I'm gonna auscultate right now the sounds of his lungs. I'm gonna use now the diaphragm of my stethoscope. Take a deep breath. Go. One more. One more. One more. One more. And now I would like also to auscultate the lateral portion of his lungs. Mikey, if you could just put these arms towards your neck. Okay. Like this. Take a deep breath. Very good. And the other one, please. Take a deep breath. Very good. I didn't hear any bronchi or any abnormal wheezing. Now I'm gonna go ahead and auscultate his anterior portion of the chest. As I put my stethoscope, just take a deep breath. Very good. So I just checked right now his lungs for any abnormal wheezings, and I didn't hear anything, which is a normal finding. So right now what I would like to do is to check his chest for any abnormal lesions or any irregularity. I could see right now that he is breathing perfectly. I didn't see any signs of any respiratory distress. He's not using his muscles to breathe in. What I will do right now is I'm gonna go ahead and palpate his chest wall. I didn't feel any hips or any trills, which is a normal finding. So after that, I'm gonna check also the tactile parameters by asking him to repeat the word 99. Can you please repeat the word 99?
99, 99, 99, 99.
I didn't see any difference also on vibration, which is normal findings as well. So right now I would like to locate the PMI, or which is um, the um, the maximum impulse over here on the left intercostal space. Okay, it's present also, and I didn't feel any bounding pulse as I checked the PMI or the mitral pulse. Right now I would like now to check the heart sounds of Mike to see for if there's any presence of any abnormality or irregularities. I'm gonna use right now the diaphragm of my stethoscope. First, I will auscultate the aortic on the second intercostal space. Next would be the pulmonic on the second intercostal space as well. The Erb's point on the third intercostal space. The tricuspid and the mitral. I just heard the S1 or the S2 sounds. There's no extra gallops or there's no murmur, which is a normal finding as well. Okay, thank you for cooperation. Right now, I'm gonna go ahead and check your arms, okay? Can you please see? I could see right now that Mikey has some tattoos on his arms and on his chest, but there's no any rashes or any signs of any infection going on his arms, which is good. While his arm is up, I checked also that there's no presence of any tremors, which is good. You could put it down now. Okay. I'm checking his hands, which is good. It's smooth. The nail bed is pinkish. There's no bluish or there's no clubbing on his fingers. The capillary refill is under 3 seconds, which is normal findings too. Okay. Maki, since I'm here, can you please shrug your shoulder for me? Okay, cranial nerve number 11 is equal, and I could see also during those procedures that he's shrugging his shoulder, his arms or the shoulders are equally going down together. There's no signs of any irregularities. And here right now, I'm gonna go ahead and check the axillary pulse, or I'm sorry, which is the axillary lymph nodes, to see for any tenderness. There's none. Okay. There is none also, which is like I could feel right now the brachial pulse. It's not bounding, it's just regular. And the radial pulse, which is normal also. Okay, thank you so much. While doing that, I forgot to do the palpate your lymph nodes on your face and in your neck, which I would like to do it right now. Okay, I'm gonna palpate right now the preauricular lymph nodes, pose, occipital, posterior cervical lymph nodes. I'm doing right now the mandibular, submental lymph nodes, the tonsillar, the anterior cervical, the supraclavicular lymph nodes, and the infraclavicular lymph nodes. I didn't feel any tenderness on the lymph nodes as I palpated, which is normal finding as well. So after checking his chest and his lungs, I would like to go ahead and check right now the abdominal portion, at the abdomen of Mikey. Mikey, I'm gonna ask you to lie down. Okay. I'm gonna go ahead and check here on the right portion. I'm gonna check first the symmetry of his abdomen. I'm gonna shine the pen light to see for the contour. Okay. I didn't see any bumps or lesions, which is good. Can you please take a deep breath for me? Okay. Very good. I didn't see any also bumps or lesion. His skin is smooth. There's no area of bluish discoloration or there's no hematoma when I check his abdomen, which is normal findings as well. After checking it, I would like right now to auscultate his lung. I am to auscultate the abdomen, the 4 quadrant of the abdomen. I'm gonna start with the left quadrant. Very good. Left lower quadrant, right lower quadrant, and the right lower quadrant. I could hear that all on the 4 quadrants, the abdominal sounds are all equal, and it's approximately 5 to 35, which is a normal finding